Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Brooke Getty, a registered nurse with Covenant Healthcare. Thank you so much for being here, Brooke. How are you this morning?
Thank you for having me. It's it's kind of a gloomy morning this morning. I think the sun's coming.
I'm waiting for the sun as well, Brooke. We're so delighted to have you. Okay, today we are talking about Covenant Healthcare's exciting new service. It's called Covenant Care Connect. And I love this name, Brooke, because it really lets you know you're getting connected. You're going to get help, and you're going to get your questions answered. So tell us what it is and how it works, Brooke.
Exactly. This is a service line that we realized was a huge need in our community. It started off as COVID-19 hotline. When the COVID crisis hit our area, Covenant quickly developed a hotline to be that one single source to answer all of the questions related to COVID. And then as it was kind of transitioning and COVID spiked again in the fall, we continued with that, but also realizing that the patients in the community needed a lot more. It wasn't just COVID questions. It was general questions like, how do I find a primary care provider, or what should I do about this medication, or should I be seen, or can I go to the ER? So lots of different questions coming our way. So we developed this new line, and it's called Covenant Care Connect, and it's where we are connecting patients to the personalized care that they need, whatever their needs may be. So it's super exciting and so needed in our area.
And I love that, Brooke, because as a mom, I always have questions, and now I know that I can just pick up the phone and call and just get my answers right away from an expert.
Absolutely.
That's awesome.
Absolutely.
Okay, so Brooke, tell us, how did Covenant Care actually come to be? You said it started with the pandemic and answering questions about COVID-19. So how did it actually start?
Yeah, well, we had an excellent team of people that was put together when COVID had hit our area. And they were like the one true source to answer all of your COVID questions, get you set up with your COVID-19 vaccine, or schedule a virtual visit to be seen for your symptoms. They were the catch-all. They led our community in all of those questions that nobody really had the answers to. But we had a team of nurses and providers and MAs that worked together to stay updated on all the latest information. And we truly guided the community as to what each step was. And as we know, everything changed daily. So they were really good at keeping the community informed. But it was that one number that you could call to ask your questions or set up, whatever it was that you needed at the time. And then also connected you to a virtual visit if that's what you required too, since people didn't really want to go out in the public, during those heightened areas. After the fall, they really wanted to transition it into the Care Connect, because we realized that there were so many more questions that needed to be answered. But COVID hit hard again, so we continued with the hotline, the COVID-19 hotline. And now that we're kind of tapering off, no admitted patients in the hospital last I knew, we are transitioning into this because it's something that we need in our area, that people feel lost. They don't know where to turn to. They have these questions, and they're not set up with a primary care provider yet, and they just really don't know where to go. And this is the one number you can call or text or get us through the MyChart app, where we can help you get set up with whatever you need, whether it's, a mobile care visit because you're homebound and you're recently discharged from the hospital, or we could set you up with a virtual visit if it's something that you couldn't make it into one of the clinics. Or if you're looking for a primary care provider in your area, we can personalize that to your zip code in your area and give you options, send you 3 to 5 primary care providers that you can choose from. It's a super easy system, and you do not have to be tech savvy to use it.
And that's what I love about it. The word that comes to mind that gives me peace of mind is convenience. It is so convenient to use. It sounds amazing, and really the place to go for answers. So tell us how it works. So break it down. What do we do? How can we get started and actually call? What do we do?
I'll give you an example. So you're new to the area, and you just got a job here, and you're not even a Covenant patient yet. You don't have to be a Covenant patient to use this service. You can call the number 583-3135, or you can text that number as well. And say you're looking for a primary care provider. You can say, I live in Bay County and I'm looking for a primary care provider. I have this type of insurance. Can you give me, some referrals on who you would recommend that I see? And our nurses can go through and find primary care providers in their area to meet their requirements, and send them those numbers. If we text it, it sets up with a hyperlink, so you can just click on the link and it'll call the physician's office for you. So it's kind of a one-stop shop, like a catch-all that you can call to get really any question answered. And if they don't know the answer, we can direct you in the right area as to where you need to be.
Yeah, you know what? I'm just thinking about this. As a mom, there are so many times I just want to pick up the phone and say, oh, I just need this quick question answered. Where do I go? This is going to be such a hot spot for people all across our region to use. It's so convenient. So tell us, is there anyone that can use it too much? Because I'm thinking that I might call, like, constantly. Can you use it too much?
No, you cannot overuse the system.
Okay.
We have an excellent team of nurses and MAs and providers that are waiting to answer calls and set you up with what you need. If it's, you're a busy mom, so you're at home with I have 4 children, so I'm at home with my 4 kids. And my 8-year-old has a rash, and I'm like, I really don't want to take all these kids out to urgent care, ER, or primary care. You could call the Care Connect number, and we could set you up with a virtual visit. And it's super easy to use. The nurses will guide you to set you up with all of that. You don't have to be tech savvy. Or, the elderly couple that is looking for a recommendation on a new dermatologist to see in their area. You can call the number and they can set you up with a couple different options or whatever fits your needs.
Right. Well,
that's the best part about it. It's personalized care, whatever you need.
I love it. It is easy to use and on the go. You can just call anytime you want to. Tell us, is there anything else? You gave us such great, valuable information. Anything else that you'd like to add about this?
I'm super proud to stand behind a service line like this because truly it is something that is really, really needed in our community. Take the college student, for example, who's newly off their parents' insurance and now they're setting up with a new insurance or just got a new job and they're getting insurance and they have no idea who they're supposed to go see. It's easy. You can call the number and speak with a nurse, tell them kind of what you're looking for, and they can match you up with exactly what you need. There's so many questions that people have and they just don't know where to turn.
That's right.
So this is going to be the one true source that you can call and get the information that you need or get connected to the people that can get you those answers.
I love it. Brooke, lastly, give us the number to call so we can start going.
It's Covenant Care Connect, 583-3135, or you can text that number, or you can also get us through the MyChart app.
That's awesome. Thank you so much. This is exciting. Right in our area, easy to use, guys. Anyone can use it. You don't have to be tech savvy at all. Healthcare at your fingertips. Thank you so much, Brooke, for calling in today. We appreciate you.
Thank you so much for having me.
Of course, you're welcome. If you would like any more information about this topic, you can head on over to the hot link section. That's at WNEM.com.